We had discussed in the previous video that for the diagnosis of diabetes mellitus, fasting and 2-hour glucose, 2 hour after giving glucose load values are taken. And then we had discussed various values when the patient should be called normal, when diabetes, and when the intermediate stage of pre-diabetes. So we had discussed all that. In this video, we are going to discuss certain pitfalls or certain potential errors during performance and during interpretation of the oral glucose tolerance test, wherein we had seen that we take fasting blood glucose and 2-hour value after giving glucose load. Now, first point, when we said glucose, did we mean plasma or did we mean whole blood? So we had said that these are plasma values or serum values because the values in the whole blood, they are lower compared to values in the plasma. Because the whole blood, it contains, apart from the liquid part, plasma, it also contains a number of RBCs. And RBC का intracellular glucose content is lower compared to that in the plasma. So if you consider the whole blood, which also contains RBCs, the values are going to be lower because of lower intracellular glucose content of the RBCs. Now, next point, whether we take venous or we take plasma glucose. Venous or the capillary glucose. Because these days, those glucometers which use capillary blood, they are very common. So they are very good for monitoring, no doubt. But for diagnosis, venous, always venous. So we had said diagnosis of diabetes when the fasting is more than 126 and post glucose load more than 200 milligram deciliter. What are these values? These are venous values. And then anhydrous glucose. Anhydrous glucose, what does it mean? When we give glucose load, that time we use anhydrous glucose. You see, the market preparations, they are actually, if you see their formula, it is glucose H2O. So that means that for every 180 gram of glucose, 18 gram of water is present. 180 molecular weight of glucose, 18 molecular weight of water. So 10% is water only. So if you give 75 gram of this hydrated glucose, effectively you are giving 67.5. 10 plus 10%, 7.5 subtract करना जरूरी होगा. So you have to make a correction for this. And then one more point we had discussed last time, that 2-hour value is actually 2-hour after giving the glucose load. A very common error, 2-hour after the collecting the plasma value. That is a very common error made. So now last point, you see, in a bit frivolous way, no mind works without a cup of tea or coffee. So whether the patient should be permitted to take tea or coffee or not. शुगर की बीमारी है तो हमने बिना चीनी और बिना दूध की चाय ले ली. So such arguments, will you accept or not? First of all, if you patient takes a cup of tea, tea contains milk. Milk means it contains lactose. And tea also contains table sugar. That means sucrose. Same for coffee also. So lactose cleaved by lactase into glucose and galactose and absorbed in the bloodstream. Sucrose, glucose plus fructose and absorbed into the bloodstream. In both the cases, glucose will directly enhance the value, whereas galactose and fructose, they are convertible to glucose. This is a question for you. I'll talk in the end. Now, tea and coffee, they also contain caffeine, theophylline. Now, I return to that argument where the patient says sugar की बीमारी है हमने चीनी और दूध नहीं डाला. But still, the black tea also contains these, black coffee also, caffeine and theophylline. And these two chemicals increase the cyclic AMP level intracellularly. And cyclic AMP, as you people know, it's a second messenger. What it does, it increases the blood glucose level because cyclic AMP is the second messenger for glucagon. Glucagon, the major hyperglycemic hormone, glucagon increases intracellular level of the cyclic AMP in the liver cells. And cyclic AMP in turn by a series of events increases glycogenolysis, thereby increasing the blood glucose level. Now, what is effect of caffeine and theophylline on this? Caffeine and theophylline, they increase the cyclic AMP level. But how? How do they increase the cyclic AMP level? A bit advanced point. Cyclic AMP is normally degraded by an enzyme called phosphodiesterase, which converts it into AMP. And this phosphodiesterase is inhibited by caffeine and theophylline present in tea and coffee. So caffeine, theophylline inhibit phosphodiesterase. So degradation of cyclic AMP will be hampered and increase in the level of intracellular cyclic AMP will occur. So I return to the question before the end, how fructose and galactose can be converted to glucose. Please find out the answer. Try to trace the pathway. Thank you so much.